This is DocHandal, and welcome to Listening Up. Today, I want to talk about stroke. Stroke occurs when a blood vessel to the brain or within the brain becomes blocked, so no blood can flow to brain tissue. So what do you think happens when blood flow stops? Brain tissue starts to die. Now that's why in medicine we say time lost is brain lost. Clot-busting drugs have to be given within the first 3 hours if you want to open up a blocked artery. Remember, 3 hours. And 3 hours includes time for medical evaluation. So every minute counts. I'm going to teach you a little of the signs and symptoms and a quote-unquote fast test to perform to recognize if someone's having a stroke or warning signs of a mini stroke. Now, signs and symptoms. Signs and symptoms include unexplained dizziness, trouble walking, sudden intense headache, the worst headache ever, sudden dimness or loss of vision, usually in one eye, sudden inability to speak, slurred speech, or incoherent speech, sudden loss of sensation or function on one side of your body, arms or legs, or sudden unconsciousness, very confused. Now remember, a TIA, or warning stroke, mini stroke it's also been called, has the same exact symptoms as a true stroke. True stroke will not go away. A mini stroke, TIA, warning stroke, will resolve within minutes or hours. TIA should not be ignored, even if the symptom goes away. I spoke about the FAST test. Now what this test is, you look at the face of the person, you ask them to smile. If one side droops, it may be a TIA or stroke. Ask the person next, the A part, use their arms to hold out both arms in front of their body. If one arm drops, again, this may be a TIA or stroke. Ask the person to repeat a simple sentence. If you notice the speech is slurred, garbled, or they make errors, it may be a stroke or TIA. Now, the T for fast means time. If any of these happens, call for medical help and get to the nearest stroke center hospital. Now, what stroke center hospitals are special centers that have imaging studies, CAT scans ready, neurologists and specialists, and medication to try and reverse the TIA or stroke. Now, what can you do? Well, don't give the person anything to eat or drink. And don't delay medical attention. That's probably the most important thing. Now, make the person calm and reassured until help arrives. Keep them comfortable. If they have any medication, give them their medication. And don't leave the person alone. Please listen to this podcast again and perform a fast test whenever you think someone is having a stroke or a TIA. Remember, any age group this can occur. Multiple things cause strokes and TIAs, not just age or hardening of the arteries. Trauma, people on certain medication, can also have strokes and TIAs, and that can affect all age groups. This is DocHandal, and thanks for listening up.